the pharmaceutical companies, not the chemo companies, not the surgeons. It's there for you. So we'll hear a few new voices, and then we'll be right back with more news.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and there was another article about antioxidants and dietary supplements. It was published in New England Journal of Medicine by two physicians, David Nuvison and Navdeep Chantel of Northwestern University. The article was reported also in Newsday this week by an author named Delphia Ricks, and she reports dietary supplements rich in antioxidants may do more harm than good when it comes to cancer prevention. So these two doctors reported in New England Journal of Medicine that dietary antioxidants have consistently failed to reduce the incidence of cancer. And they referred to numerous clinical trials. Now, I know that many patients come to me on tons of antioxidants, vitamins, vitamin A, C, E, but the problem is the data keeps on showing actually that the death rate is increased, not decreased, in almost all these major randomized studies. So I just urge you, if you have a cancer and you're relying on antioxidants, you may want to give us a call at 212-CHOICES and come in and get treatment that isn't toxic, but a treatment that is effective and proven over time. It's really incumbent. We've had so many people so sorely disappointed after taking antioxidants and vitamins and alternative methods. Please look at the data. I'll be happy to show you the data if you want. Give us a call, 212-CHOICES. I'll sit down with you and show you that data. We have another gentleman who came in, 83-year-old man, widowed man with 5 children, who has a PSA of 15 with a massively enlarged prostate and short of breath. We're getting him taken care of for his shortness of breath and for his PSA, and he's urinating several times a night and throughout the day. He's having great trouble with this urination and controlling the urination. He saw other doctors that want to do green laser on his prostate and a TERP, ignoring the fact that he has a massively enlarged prostate and his PSA is 15. He probably has prostate cancer. So, wow, shouldn't we be taking care of the cancer first, if that's what he has? He's never had a biopsy. He needs evaluation. I'm getting him worked up. He came in. We're getting everything done. We got a blood test, urinalysis. We're getting everything worked up, and we'll report back to you and him. This man works 7 days a week. He's a driver for a limo. He owns his own limo. He's an active man. He's 83. He most likely is going to live another 10 or 15 years. He's probably more likely to make it to 100 than many of us. And I think if he has prostate cancer, he should know about it and be offered treatment to try to cure him, rather than just let the cancer grow and spread and possibly take his life in a painful way. We don't want that. No, we don't want that. And we have a woman who came in this week with cervix cancer. She is about a 50-year-old black woman. I only say that because death rate in the black community is about twice that in the white community, and a lot of it has to do with not showing up for some appointments. This woman took 5 weeks. I saw her 5 weeks ago. It took her 5 weeks to come back for the follow-up visit. And I told her, the cancer's growing. The cancer's growing while you're thinking. And we got everything worked up. We got a PET CT scan approved for her immediately and got it done immediately. I examined her. She had masses in both the right and left breast. We got her arranged to get a little needle biopsy of the right and left breast, which she desperately needs. All done immediately. All she has to do is show up. So please show up. We can take care of you. Right now she has a localized cervix cancer confined to the cervix area. No spread. High chance of successful outcome. The cervix cancer, by the way, is often detected by Pap smears, and it usually can be detected before it gets to the cancer stage. So again, for women, well, studies have shown you do not need pelvic exams regularly. You do need Pap smears. Pap smears is taking a smear of the tissue of the cervix, testing it. Had this lady had routine Pap smears, most likely she would have never had invasive cervix cancer. So please, test your cervix, Pap smears. There's actually now even a vaccine for boys and girls to help prevent human papillomavirus, which is the major cause of cervix cancer. So if you have children, please see your doctor about the vaccine to help prevent your children from getting this terrible infection, which can lead to cancer of the cervix in girls and other cancers in boys, like we talked about, even cancer of the throat. So this woman, she has localized cancer of the cervix. She's getting treated. We got her mapped out, and she's starting treatment this week. What more can I tell you? We saw a man. We actually have a complete department for Spanish-speaking patients with Spanish staff and Spanish doctors and Spanish literature. So if you're a Spanish-speaking patient and want information, you can call that same number, 212-CHOICES, and we'll mail you information in Spanish. This man, a Spanish man, is about a 60-year-old man with a mass in his face the size of a softball. Massive. Now, it's squamous cancer of the tonsil that's grown and occupied most of his cheek, swollen up like a big softball. He was seen by surgeons 2 years ago who only offered him deforming surgery, and he walked out on the surgeon. So he got the biopsy. He was told he had to have surgery, which I don't think was really true. I think he could have had other options available, including non-invasive options. He was so angry he walked out. We got him staged up. Now he has an increased size of this mass. He has a mass in the cheek. He has lymph nodes in the right neck. He's got a metastasis to the 7th cervical vertebrae, the bottom of his neck. and multiple lung nodules. So he apparently made a decision that led to the cancer to spread because he was so angry and upset at the surgeon. Now he has stage 4 cancer. He's decided to come with us to try to shrink down this cancer and treat the mass in the spine and in the lung. He's here, and we intend to help him as much as we possibly can. Most likely we can get him into remission. If you have questions during the week, please call us at 212-CHOICES. My name is Dr. Lederman. 212-CHOICES is 212-246-4237. Again, that's 212-246-4237. If you want the booklet DVD, call us Monday through Friday. Thank you for listening. Talk to you next week on WABC Saturday and WOR Sunday. God bless you. Bye now.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.